The sounds are often reality.
You can imagine you've sustained this terrible injury.
Maybe have bandages on their hands so they can't access the call light and can't communicate well, or patients that can't speak because of tracheostomies.
They can't speak, they may be immobile.
With 35 million patients visiting hospitals each year, a surprising amount wake up feeling helpless.
Roughly 3.9 million of these, at one point or another, can't communicate or access a nurse call, yet they're cognitively intact.
A problem Matthew Howard, professor and chairman of the Department of Neurosurgery at the University of Iowa, says he's dealt with throughout his 30-year career.
You can't communicate at all. You can take all the time you want, but you just can't.
A new product out of Coralville is bridging that divide.
A lot of patients can't, use nurse call buttons and they can't speak. So what they can do is use mouth sounds.
It's called the noddle.
Slang like noodle for brain, but also you think about the beginning, the prefix of it, nod. Well, that's a voluntary gesture that we make to communicate.
A click.
You activated the nurse call button. Did you need something?
Sending shock waves through the medical field.
My head hurts.
This is a completely emerging market. Nobody's ever done this in the hospital, yet it's hugely, hugely needed.
The portable device comes with a tablet and sensors ready to plug in and play.
They can click their tongue and move the cursor around the screen here,
providing vital feedback instantly.
Hello.
and the tablet speaks for them.
The noddle is currently in use at the University of Iowa Hospital.
Very fortunate, I think, especially since we're the only academic medical center in the state of Iowa.
Jolynn Schneider,
They're talking about setting up the noddle for room 5.
the burn trauma unit's nurse manager, says it's been a godsend.
Before that, we would have to read lips. We would have to maybe put a nursing assistant to be with them in the room so that we knew when they wanted help.
Now, with the noddle,
If they want to call the nurse, then they just click 3 times.
Please get my nurse.
Triggers the nurse call that's hooked up to the back.
We can meet the patient's needs in an appropriate amount of time, and that's a huge thing as far as patient satisfaction goes.
the groundbreaking device comes from humble beginnings.
In 2013, at the University of Iowa, there's a program called IMEG. It stands for Iowa Medical Innovations Group, and it's comprised of a group of students.
Students, along with Dr. Richard Hertig, the chair of speech and communications at the University of Iowa, came up with the idea.
Generally, IMEG is designed as a student program. It's to simulate businesses. It's not expected that an actual business will come out of it.
But it did. And in 2015, Reeves Bird created Voxello simply for the product, which benefits more than just the patient.
It's tremendous for the families to be able to know that patient and that loved one is not locked in. That person is not excluded from being able to communicate.
Also creating buzz, Voxello says it will help with the hospital's bottom line, as the new advancement in communication can catch costly preventable adverse events hospitals must pay for, such as pressure ulcers, adverse reactions to medicine, or aspiration pneumonia, before they happen.
How bad is your pain?
My pain is at level 8.
It can be very, very expensive. You're talking on the order of $10,000, $20,000, $30,000 per incident.
Saving money and valuable time when seconds can change a life.
I feel nauseous.
This group has essentially invented a new field, and this is the first step.
Giving power to the powerless.
This system is quite remarkable.
My head hurts.
And a voice to the voiceless.
And then select with 2 clicks.
Please quit bothering me.